Hi there, it's Dr. Ryan, and today we're going to talk about a topic that comes up periodically in my clinic, what to do uh, prior to a procedure. So you're scheduled a procedure in my clinic. It's usually for patients who are getting orthopedic procedures, a joint placement, replacement, or in females, something that's more gynecologic related. So like a hysterectomy or fibroid surgery. But regardless of that, are there things that you can do to optimize your outcome postoperatively? And it appears there are. So I created a short presentation on some of my suggestions as to what to do. One thing before we get into this is these recommendations need to be taken with a grain of salt. Make sure to discuss anything that you plan to do preoperatively with your surgeon or proceduralist, because you want to make sure that you give them, he or she, the best opportunity to give you a good result postoperatively. And whereas these interventions are unlikely to cause much harm, I would always run them by your proceduralist beforehand. Okay, so getting started here. So whenever I think about a procedure, I like to think about it in terms of three phases: the preoperative phase, the intraoperative phase, and the postoperative phase. So obviously we're going to focus on the preoperative and the postoperative phases, because the intraoperative phase, there's not a lot you can do in that regard. It's really dependent on your surgeon, anesthesiologist, CRNA, and OR team. So preoperatively, what are some things that you can improve upon? Well, your emotional state is likely to help. So doing things that can reduce anxiety, uh, trying to get as much knowledge as you can about the procedure, talking to individuals who may have had the procedure beforehand, had a good outcome, obtaining counseling if you're extremely anxious. These things can be useful. Having a positive outcome, a positive attitude, and visualizing a good outcome can be a lot more important than we once thought. There's a lot of research suggesting individuals who are optimistic and view life as just a view challenges as things to overcome rather than setbacks, right? Likely tend to do better in life, and certainly in the healthcare setting tend to have less morbidity and mortality. So it's a good thing if you can. Nutrition. So as much as 40% of acutely hospitalized patients are malnourished, and this is kind of a general statement, but it refers primarily to vitamin deficiencies, supplement deficiencies, and of course, or mineral deficiencies, and things that occur from eating a unbalanced diet. So a diet that is not comprised of lean protein, complex carbohydrates, and healthy fats, which can lead to poor insulin sensitivity and long-term lead to slow wound healing, a lethargic immune system response, and muscle weakness, which, as we'll find out, since mobility is important postoperatively, that's not a good thing. Preoperative fasting. Well, so the main concern here is prior to the procedure, you want your stomach to be completely empty. Why? Because if there are stomach contents, if your stomach is full of food, there's a chance that it can come out of the stomach and go into your airway and lead to something called aspiration, where food is goes into your trachea, into your bronchus, and potentially can cause a pneumonia, right? And to avoid that, ideally, you want to fast for a period of time. And there are strict guidelines for this. This is something that your surgeon, anesthesiologist, CRNE will talk to you about. Ideally, it should be no longer than 8 hours. So in some cases, some OR teams advocate 12, but I would talk to them and see if they can be okay with 8. If it's a light meal, such as toast or clear liquids, 6 hours may suffice. And this again, this is the amount of time prior to the surgery. Clear liquids, generally most operating room teams are okay with 2 hours prior to the surgery. And then again, make sure to check with your OR team in advance, because the last thing you'd want to do is delay your surgery because of because of a miscommunication between you and your team, and the fact that you're kind of hungry. There is some evidence suggesting that carb loading prior to your surgery could help, but not carb loading with fast food, but more so with complex carbohydrates such as brown rice or yams. And the idea is you want to really fill your glycogen stores, so you can utilize that intraoperatively and postoperatively, because you're going to be fasting, of course, rather than breaking down protein, right? And then glucose control. So ideally, you want to optimize your insulin sensitivity, and really this should be done, in the months prior to your surgery. There is a definite correlation with poor wound healing if your hemoglobin A1C is greater than 6.5. And most of the patients in my clinic, I really try to, move towards significantly under 5.7, ideally under 5 if all possible. And that's definitely attainable over the course of months. But again, this may not be possible if this is a surgery that you have not planned for. Post-operative period. Okay, so pain is a big issue. So one of the drugs we utilize pretty commonly in terms of pain control are opioids. And I understand there's a role for them, but try to minimize them if at all possible. There are a lot of side effects associated with opioids: constipation, nausea, and vomiting. Those are the main ones that people have to deal with. And of course, long-term opioid usage, there's the concern with addiction, right? So again, if at all possible, talk to your OR team, see if there are other anesthetic techniques that that can be utilized that could limit the use of opioids. Regional anesthesia with a block, such a certain adjuncts such as IV acetaminophen, IV Tylenol, or certain NSAIDs such as Toradol. See if those are appropriate during the surgery and can reduce pain without the side effects of opioids. And there is some interest in non-medicinal interventions. And again, these would be some things that you'd have to obviously talk over with your surgeon, or maybe start prior to the surgery, but could offer some benefit post-operatively. Hypnosis. So working with the medical hypnotist and kind of, instilling images and statements along the lines of, I will be pain-free after the surgery. I will recover quickly. I won't have any untoward issues coming out of surgery, things like that. Kind of lodging that in your subconscious. And there is some evidence to suggest that it could be helpful. And certain types of massage have been shown to help post-operatively for pain. Now, again, this is all dependent on the surgery and whether or not it's appropriate, depending on the site of the surgery. Wound healing. So again, you want to ensure that the incision is healed appropriately. So you want to really balance your inflammatory response. The inflammatory response is a very important part of wound healing, but it's just inappropriate when it's prolonged. And there are certain supplements you can use to kind of to optimize that response. And then, of course, appropriate nutrition, having a balanced diet of protein, complex carbohydrates, and fats can help with wound healing for sure. Physical activity. So you want to ideally be moving around as soon as your proceduralist deems it to be appropriate. And the idea is, with prolonged bed rest, there is the potential for a deep venous thrombus. And this is just essentially like clot within a vein. And that the problem with that, of course, is that that itself can be painful, but it may break off and embolize and go into other areas of your body, like your lungs, which would not be a good thing at all. And, muscle weakness post-operatively is going to, prolonged bed rest can lead to muscle weakness, but if you had muscle weakness prior to your surgery, owing to the fact that you didn't have an appropriate diet, or you engaged in resistance training, you didn't have enough muscle mass, that's likely going to worsen the situation. And then finally, under anesthesia, depending on the type of anesthetic you get, if you're intubated, many times the little air pockets in your lungs, the alveoli, can collapse, right? And so ensuring that you utilize some form of spirometry or incentive spirometry. This is an incentive spirometer here, something to help pop open those air pockets. If it's okayed by the team, it would probably be a good idea to reduce the risk of pneumonia. Okay. And now we're going to kind of talk about some integrative approaches. But before we do that, I just want to talk a little bit about the 4 phases of wound healing. So generally when, your body incurs an insult in terms like an incision, the first phase of healing is hemostasis, where a platelet plug or a clot is formed. It's primarily just platelets and clotting factors and vasoconstriction. This usually happens immediately, or at least within like the first, and it should be done within like the 30 minutes, an hour or so, because ideally you don't want to lose a ton of blood, right? And then the inflammatory phase starts, and this is a necessary part of wound healing. A lot of people think, oh man, inflammation is terrible. It's important. It's just the problem is when it's prolonged. Ideally, it shouldn't be more than 1 to 4 days post-operatively. And it's important in that that's where the white blood cells come in, and they start to attract other cells that are important in remodeling. They stave off infections. They release cytokines that are really important in terms of blood vessel dilation to allow movement of other cells to the area, and you get the scab formation. And again, it's important, but you want to limit it to that 1 to 4 day time period. And then after that, from about 4 days to about 3 weeks or so, you enter the proliferative phase. And this is where you initially have your scab formation in the first, 1 to 3 days. And the proliferative phase is where, you start to re-epithelialize, you start to see some healthy epithelium come over the wound. You get fibroblasts that start to deposit collagen. You do get some vascular remodeling, some more vessels that are growing, angiogenesis. And then finally, remodeling is the very last stage, and this can last anywhere from 3 weeks to even 2 years, right? And that's where, you have scar formation, you have contraction, which is really just secondary to the collagen maturing, changing from type 3 to type 1. There being water retention or water removal. Certain cells die off, they aren't necessary anymore by a process called apoptosis. And you get the finalized scar, right? So, and again, the main point I wanted to make is the inflammatory phase is important, but it's just, you don't want it to be excessively prolonged. Okay. So one thing that has been useful is the use of use of immunonutrition, or a specialized preoperative drink to take that offers protein, vitamins, materials, or minerals. There are a couple of studies suggesting this is one of the commercially available powders out there, oral impact. And there are some research studies suggesting that, I gotta open this up, that's suggesting that it has some benefit. So there's a study looking at preoperative immunonutrition on complications after salvage surgery in head and neck cancer. And these authors found that preoperative immunonutrition exhibited favorable effects on the complication rate and seemed to reduce the length of hospital stay for this particular surgery. So this is something you may want to consider talking with your surgeon about. And generally, most immunonutrition or those sort of preoperative drinks tend to have a combination of some sort of micronized protein, vitamins, minerals, omega-3 fatty acids, which are important to modulate the immune response, and arginine and glutamine, which are essential amino acids that are really important in angiogenesis, T cell proliferation, and again, modulating the immune response. And what are some supplements that could be a utility? Well, vitamin C. And again, there are multiple studies looking at the benefit of these supplements. I've listed a couple of them in the summary below, and you're welcome to go through them. I'm just going to list some general guidelines in terms of dosages. And again, I strongly encourage you, if you plan on utilizing these supplements, to talk it over with your proceduralist and make sure they're okay with it too. So, vitamin C is associated with a decreased inflammatory response and seems to decrease oxidative stress markers. There's been a few studies suggesting it can do that in cardiac surgery. and anywhere from 500 to 2,000 milligrams a day may be of utility. Vitamin E has been shown to improve wound healing and improve scar appearance. It may even reduce the rate of surgical site infections, and a dose of 400 IU daily would be a good idea. Vitamin D, we all know it's important calcium absorption. So it has been shown to potentially be helpful in bone health and formation post or in orthopedic procedures post-operatively, and some improve functional recovery in hip fracture patients. 5,000 to 10,000 IU is what's generally recommended. Omega-3 fatty acids. Fish oil is a pretty good source of these, 5 to 10 grams daily. And the idea behind this, again, is they modulate the inflammatory phase. They kind of cap it at that 1 to 4 day time period. And it's primarily because they tend to seem to decrease the amount of inflammatory cytokines that are released. So it's not excessive. And those would be things like TNF alpha, IL-1, IL-6, and instead promote cytokines that are more related to reducing the inflammatory response, moving it into the remodeling stage, or sorry, the proliferative stage, such as TGF beta and IL-10. Coenzyme Q10 also seems to reduce inflammatory cytokines, and there is some research suggesting it can improve perfusion to end organs in cardiac surgery, so primarily kidney function, and 200 to 300 milligrams daily is a good idea. Zinc is a cofactor for many enzymes in the process of wound healing, and it may improve fracture healing. Curcumin at a dose of 1 to 1.5 grams daily is a potent inhibitor of NF-kappa beta. And it's a really, really powerful protein that's involved in the inflammatory response, so it could be of utility as well. And then, of course, you're going to be taking antibiotics definitely intraoperatively and postoperatively, which can disrupt your normal gut flora. So taking probiotics preoperatively and postoperatively may be a good idea. And you want to choose a good brand that ideally has 50 to 100 billion colony forming units. Okay. And one thing to also mention is you can take these, prior to your surgery as well, maybe a month or two prior. But again, based upon what your proceduralist gives you the okay for, these are just some general recommendations. Are unlikely really to cause much harm, but again, double check with your surgeon and proceduralist before you undertake a regimen like this. Okay, so hopefully this has been helpful, and I will see you guys in the next video.